And next segment is the Ontario Office of the Chief Coroner role and general response to workers' deaths, intro to the 2021 review on COVID-19 related deaths of temporary foreign agriculture workers in 2020, and the stakeholder engagement strategies. And our speaker, thank you for coming, Dr. Reuven Gerhard. He is the Deputy Chief Coroner, the Government of Ontario. He's also an assistant clinical professor of pathology and molecular medicine at McMaster University, and he probably has many other titles that I don't know about. But Reuven, please take it away.
Thanks, Michelle, and thank you all for the opportunity to talk with you, and it's a privilege to be able to present, and hopefully I'll be able to answer some questions and address some concerns or other points that that you've already raised through the process of this talk. I think it's important. Certainly, the last few years have been very profound in terms of impact, and hopefully, we can get more information from all of you in terms of other steps forward. So what I want to do in this talk really is get to the point of talking about our office and its response to work-related deaths. But to do that, we have to actually talk about how our office conducts the investigations that it does, and what its scope and reach is. And obviously, we will get to some of the specific aspects of the deaths that had to do with some of the workers, as we went through that in the process of the report. So really, when we think of the office, the mission has always been based on the motto, which we've been talking about here, and as the previous report indicated, many things are preventable, right? So to learn from those death investigations, to learn from the circumstance around any particular deceased person and the events that happened to them, to not only give information to the families and friends of that loved one and the surrounding communities as well as surrounding society, but to then take those lessons forward and protect and prevent deaths. So, the Office of the Chief Coroner, the Ontario Forensic Pathology Service, in the essence of these, death investigations, when one talks about high quality, it can sound like a vague term, but ultimately, the goal of any high quality investigation is really to capture all the elements of truth of the event, of what happened, of the death, of understanding not simply, that end stage of, yes, this disease process occurred or this particular motor vehicle collision event happened, but ultimately the things that contributed to that happening. And I think that the previous summary of the report really clearly tries to understand some of those mechanisms, some of which are beyond the scope of our office. So thankfully, the expert working group was able to take the report that existed prior to the levels of their expertise, because ultimately we can't be, nor do we, try to be experts in everything. So we do need to rely on that knowledge and capability for people around. So inquests, as it says there, are to also ensure there is a public dissertation of the facts of the events, of the discussion, to ensure that things aren't concealed, they aren't ignored, that the people and the public get to learn about something, so that there isn't a concern that things are being potentially concealed, things like that. So ultimately, inquests can have a different scope. They certainly have a different public perception and capability of doing things. But we will go into that in a little bit more depth as we move along. So really, we have the Office of the Chief Coroner, and the OFPS is the Ontario Forensic Pathology Services, is this partnership of investigative abilities that we have here. Everything that we do is governed by the Coroner's Act. So all the rules that we have to follow, all of the sort of legislative abilities we have are all documented in the Act. The notification of the occurrence happens. The coroner is then dispatched to a scene. There's an attendance there. The coroner then investigates the death and, as I said, all of the surrounding events, and that can go back in time and can be sometimes be quite extensive. And that involves working with other investigators like the Ministry of Labor, obviously police services. We have certain authorities, and some of them are quite profound: the ability to inspect, the ability to enter, the ability to seize. Obviously, we can take jurisdiction of the deceased person. We're charged with communicating with all of those people and helping provide answers. And then there are the subsequent process. Inquest is the most well known, but we have committees like patient safety and domestic violence and maternal and perinatal. There's a geriatric committee. Anyway, so all of those can also then help produce recommendations. So the process that we will be getting to that led to this report was a rather, well, it was unique and it was new, and we wanted to deal with some things that were happening very early on in the pandemic. Obviously, in that first wave, there were significant concerns. We were dealing with a sort of new virus, the SARS-CoV-2 virus. We weren't necessarily clear who was at risk and how things were, but we were very quickly learning. There was certainly a significant number of elderly people that were dying in long-term care, and there was a lot of obviously responses to that. And then the deaths of the workers started to occur, and ultimately the goal was to try and understand that within the context of the concern about more workers continuing to come, and what we could do and how we could do it in a timely manner. And that is why initially that process was deemed to be probably the most timely. And again, we created it as we were moving through that in terms of interacting with various levels of government, various sort of agencies, support groups, community advocates, and union, working with families, working with communicating with other workers, and trying to learn what we could in doing this. So there's a lot of writing there, but really all you need to know is the coroner's office is a significantly organization in the sense that in terms of death investigation services in North America, the Office of the Chief Coroner and the Forensic Pathology Service in Ontario is the largest in terms of its cases in North America. New York City is a very big city, but its medical examiner system is limited to that city, and then outside its jurisdictions there are different systems. Some are medical examiners, some are coroners, some are mixed. So somewhere between 90 and 110, 120,000 people in Ontario die a year. We probably investigate about 20,000 of those deaths, so roughly about 20% of all the people that die in the province, and is either reported or investigated by our office. So really, we have to investigate every death that is not natural. So all of those have to be investigations. You can clearly see that in section 10 here. This is only part of that section. Having said that, the vast majority of investigations are quote unquote natural deaths, and I will explain all of that in a few minutes. The bottom part of this is just to show where there are mandatory inquests. So those are deaths that occur from people that die as a manner is called an accident, but at a construction project, mine, construction, as we talked about, and those are mandatory inquests. And we will again define mandatory and discretionary as we move along. So really, what is our mandate? Well, we have really the investigative mandate, which is to answer 5 questions, and a preventative mandate to learn what we can and to prevent further deaths. An older version of the Act used to say prevent deaths of a similar nature or a similar cause, but we needed to broaden that for public health and safety reasons, just to prevent further deaths, which was, I think, so importantly stated throughout the previous presentation. So what are those 5 questions? Well, clearly the 5 questions are: who died? That is clearly of significant importance, and that has to be 100% all the time. When did they die? And some of that is semantic in the sense that somebody may have died on a particular day but may not have been found right away. The death is actually at the time that they're pronounced, and pronouncement can happen not necessarily just by a coroner but by other people. Where they died, why they died, which is essentially the medical cause, and the means. So the means is called manner of death, and there's 5. We have natural, accident, suicide, homicide, and undetermined. And as I said, the vast majority of investigations are natural, although all the other 4 we have to investigate. So on the coroner side of things, there's a chief coroner. There's essentially 3 deputies, but one of the deputies is actually the chief forensic pathologist. We have regional supervising coroners who cover various regions of the province, and roughly over 300 investigating coroners who are currently physicians. We are looking at how investigators can be and how to make sure that we actually have full service provision throughout the province, including the remote regions. And we have coroner investigators, whom there are nurses, and obviously we have made deaths reported to our office. The Ontario Forensic Pathology Service. So the coroners are the investigators that go to the scene, meet with people, meet with the family, meet with the other investigators, and they do what needs to be done at the scene. And then we have the Forensic Pathology Service, which is the chief forensic pathologist, their deputies, unit directors. There's a register because there are forensic pathology units throughout the province. There's one in London, for instance, in Ottawa, Thunder Bay, Sudbury. There's and one in Kingston. And then they are the physicians who actually carry out the post-mortem. So as we say, we do about sort of 20,000 investigations, say 18 to 20,000. Not all of those have a post-mortem. For some reason, some family doesn't necessarily want one, and we can try and come up with a full explanation of the events without necessarily doing it to meet the needs of the family. But sometimes, obviously, there are some important reasons that a postmortem has to occur. Public safety, obviously, if there's concerns of a criminal nature, then there's the need for a postmortem. But there's roughly somewhere around 8,000 postmortems a year. So not all the cases involve a postmortem, but the forensic pathologists and the pathologists throughout the province are responsible for that, and to determine cause and help answer all the questions around the investigation, as well as the provision of reports and the testifying in court, and also testifying at inquests. So here's just some breakdown of some of the deaths in the inquest over the last 10 years that you can see. In the first sort of area, as you look over the last 5 years, and the numbers under 2021 have an asterisk. It can take anywhere from 3 months, sometimes sooner, to a year to finalize an investigation, depending on how many special tests are being done and how long things are going on with other processes and other investigations. If we're relying on, for instance, information from the police service or the Ministry of Labor, and we need to incorporate those results in our investigation and communicating with other places. So 2021's numbers are by no means final. We are still closing some of those cases, and that number, 95, is not a drop. It is just because we are still within the 6 months to 12 months post-closure of some of those cases. But you can see that there are some sort of breakdowns there. You can see over the last several years how many mandatory and discretionary inquests there have been as well. So, and you can see what is still pending. And it is within that context, also within the context of COVID, that there was the difficulty in sort of trying to necessarily have an inquest immediately. It's a process where the courts were shut down and we weren't able to do certain things, and some things were trying to be done remotely, and all of those challenges were occurring, but we felt the pressure of trying to respond to what we saw as a public health need, and the importance in our initial discussions with all the groups that were involved, the various levels of government, that we needed to do something in a much more timely manner. So between sort of discussions starting in August, September of 2020 to the formal discussions in December to March of 2021 and releasing the report in April, was important to try and get everything going. And that process was unique. But I'll come back to that in a couple of minutes. So under inquest, we've talked about investigations very broadly, and certainly I can help answer any questions anybody has. There are two aspects to an inquest. They're either mandatory, i.e. in the Coroners Act, and I showed you one section, 10.5 there, and then we have discretionary. So any case investigated by any coroner could theoretically be an inquest. So the coroner could very well write their own recommendations from a singular death investigation. We could look at several deaths that are quite similar, as we did in this scenario that involved these workers, and try to do a very sort of significant review of all the events, bringing all the applicable people. So that was not at all meant to replace an inquest, and there's still considerations actually within the office going on about an inquest. So certainly there hasn't been a formal decision, but that means there has also not been a formal reason not to. And as previously stated, we don't have an inquest of one of the workers from the significant number of deaths that have occurred over the last few decades, to be quite honest. So mandatory is essentially deaths in custody. Talking about the construction mines and quarries. The restrained is physically restrained. There are chemical ways to restrain a person when they're, going through the struggles of the mental health issue. But physical restraints in a psychiatric institution is a mandatory inquest. Deaths of children in certain cases. So essentially, these you can see are mandatory because essentially the state or the care of the state and the protective measures that exist are in question whenever one of these deaths occur. Now, deaths in custody are specific, obviously, to non-natural. If somebody was in custody and they had a known terminal illness, the case would be investigated by the coroner's office, but wouldn't necessarily be a mandatory inquest if they, as I said, had terminal cancer and their death was understood and expected. They just happened to be in custody. So, what are the functions of an inquest? Well, we talked about this. It's a public ascertainment and discussion, and involves several parties, family as well, and anybody connected to the processes that were involved in understanding why that death occurred, and that includes the potential socio-demographic factors that's necessary. And here we tried to tailor some of the processes to a review with respect to the report that came out. And hopefully it tries to address some of the community and in this case, working and worker-related concerns around the death to ensure that things are publicly reviewed and allowing for that. So when you look at the preventative aspects, you get recommendations aimed at death avoidance, and majority of which are acted upon. And the interesting thing that happened with this report is because all the parties were engaged from the beginning, and the discussion of the recommendations was ongoing. Many of the recommendations were being independently acted on by many of the ministries as well as the federal group. We had, within the report, you saw a federal response, and the government of Ontario is also responding as a whole of government in terms of, demonstrating what has changed at 6 months, and we are now going to be, reviewing any of the responses for the 1-year follow-up as we're at that point right now. We want to address policies, procedures, training, and again, this relied on not only the government agencies and the public health agencies and the municipal and the community supports. It brought in the experts and it allowed for that, and it has, again, led to a much more in-depth expert review that was specifically using the knowledge and awareness of the issues by the expert groups and by anybody else. And so there'll be some contact information for Julia and I, who were sort of helping work on the report with all of the other parties that were involved. that I'll have that on the last slide, so you can certainly email either of us for either further questions, or if there's something you're contemplating wanting data on, we can hopefully provide that to you. So, this report did come out, as I said, in April. It did look at all of this and had about 35 recommendations and subparts that tried to address many, many things. And I think that's there. And certainly we, as I said, learned much from all of the ministries. And coroner's authority that I spoke about limits us in our abilities to make demands of any of it. So thankfully, we have had a remarkable response to many of the recommendations. The government's ministries were doing much of this as they were going through this process as well. Public health responses and have been impacted, I think, by the information that was generated by all of the people involved, communicating and trying to come with a more comprehensive, interconnected way of approaching a very, very, very complex issue. And by no means was the report meant to be comprehensive and a unified statement, as it states. It was trying to reach, as many of the issues as possible and discuss things. And, we couldn't cover some of the very specific strong worries that occur, like specific things that are within the realm of other agencies. And as I said, we have no way to enforce the recommendations. Our investigative powers are where our major authority is in the ability to seize records and do things and gather information. But this whole aspect has been profoundly impactful on the office because, again, it allows us to understand all of those social, political, economic issues, all of the power-related issues that exist, the cultural issues, and then starting to look at what constitutes an at-risk, marginalized group, right? From temporary foreign agricultural workers or the international agro-food workers to, obviously, indigenous communities, people have housing instability, gender, and sort of other related issues there, age-related, both extremes, both very young and on the older spectrum, and the vulnerabilities that exist, the ethno-racial concerns. So we are looking at that, and we're actually doing a significant review with the data. Much of our data in our older system was limited to whatever the coroner was able to obtain. And I think some of the issues that were raised in the expert report illustrate some of the limitations in our current newer system. Over the last year, we are trying to gather much more of the socio-demographic data to be able to understand things in a way that we didn't have before. And we are just starting to do all of that. As I say, we're exploring these issues with several stakeholders and experts, and hopefully it's going to impact on not only death investigation systems, but other processes to not only prevent death, but also enhance the health and well-being of not only the population surrounding an event or an occurrence of deceased persons, if they're connected to even a singular death, and providing the information to the family and friends, whether it's genetic concerns and risks that exist there, to more in-depth answers around potentially why and what happened. So those are all of the sort of issues there. I know I've kind of gone through quite a bit very, very quickly. Apologize for the speed, but I wanted to cover some of the background. And there is some further contact information. Certainly feel free to email either myself or Julia. We'd be more than happy to help either get data if you wish. One of the things I forgot to mention around that table where I was listing some of the previous worker-related deaths is there are some deaths that occurs in mines, but when the numbers are low, we tend not to specifically state them. We'll just say essentially less than 5 or less than 10, because when you get to numbers like 1 or 2 or 3, it can impact on confidentiality, because if somebody knows that 1 or 2, they may know some of the information that we're presenting. So we, although I can't speak to specific cases, I'm more than happy whenever anybody has any questions, whether it's here or in follow-up. So with that, I think I will stop and address any questions.
That's great, Ruben. Thank you for that. And you didn't use too much time at all. So are there any questions for Ruben at this point?
I have a question. Well, thanks for the presentation. I think it actually was, it's very helpful for all of us, I think, to understand the scope and scale of the Chief Coroner's Office and being the biggest one in North America. That is actually amazing. And I can see that, and I was also very interested to see this stat of 118, I think, work inquests in 10 years, and now there's already a list of 124 waiting until they can be reinstated. So it is an immense amount of work. And I also considered the whole, like, the discussion here and the investigation in your report, and then building on that to the expert working group report. I think that I think it's been a positive step forward, and the future engagement with stakeholders, I think, is positive too. So I guess I was wondering, as you were speaking, about whether, when you were talking about looking at groups and potentially doing an inquest or an investigation when you see patterns of things, or looking for a potential pattern, of whether the coroner's office has done any other investigations, of which I'm not aware, over the pandemic, that would, like, for instance, nosocomial infections resulting in healthcare, or for instance, limousine drivers who apparently 10 or 12 died in the first few months of the pandemic. People driving in Pearson, moving all around the risk, the airborne risk, and the congregated risk. I just wondered, have there been other COVID-related investigations so far, I guess?
Coming back to what I was saying before around natural deaths and what is reportable, the vast majority of COVID-related deaths, I mean, they're all natural deaths in terms of what's going on. So the vast majority aren't reported. We wanted to be involved with, obviously, what we needed to be involved in and could. One, to help provide information on a new disease process and understand what we could. So your question is absolutely, appropriate in the sense, and quite direct and important, because that was the difficulty at the beginning, and continues still to be the difficulty, to make sure that we, one, get notified, because the vast majority of time we're likely not getting notified. We had to seek out some of these cases, and in fact, in one or two of these cases, the coroners may have turned it down, and when we found out that it had been turned down, reversed that decision to go back and investigate, because the importance of understanding all the mechanisms around it. So you're absolutely right. So some of our ability to investigate something is predicated on us knowing about it, and within the context of COVID, that is something that we knew at the beginning very well, but as it started to progress through the next year or two, whether the death was at a hospital or was expected or a long-term care, we weren't necessarily as directly, immediately notified. We got involved, obviously, with immunizations because there were some public concerns and stuff right in there. So we tried to look at those things. Certainly, we have been looking at other things that have been coexisting in terms of concerns with respect to the impact of COVID, like substance-related deaths, deaths in marginally housed populations, and the increased numbers that have occurred there over the last 2 years, that has been quite profound and dramatic. So yes, we are, but they fall within the realm of a non-natural death, so we have a much greater ability to point to those numbers. So yes, we do try to do that when we understand that it is going on. Certainly, we've had questions with respect to manners of death and what's changed. We're certainly quite aware, because our office also looks at anybody who, in essence, has chosen cremation as a disposition. To have a cremation in this province requires a signature by a coroner on a cremation certificate. So that requires the review of a death certificate, which then gives us the ability to look at all of those deaths and review them. So we've been looking at cremation certificate data for the last few years to try and understand processes there. So hopefully that's answering some of your questions. I think some of the specific things, absolutely, if we aren't aware, we can go back and look at and see what we can do. We can. Anybody, as I said, who has died within the province is within the realm of an investigation, and certainly if there is something that is or that hasn't been reported, we have that ability to go back and at least try and do a chart review. Obviously, some people have gone through either, a cremation or a burial, and that may limit our abilities in terms of physical findings. But certainly we do try to extract what we can, particularly when even, like I said, we don't have to necessarily investigate natural deaths, but in these scenarios, finding as much information is really very important.
Thanks.
Thanks. I have if there are no other questions, I have a comment and a question, Ruben. It's Michelle. So the comment is on the process of doing the review, and I guess having participated in that, definitely recognition of the amount of time and work that went into that review, and the engagement with the right stakeholders and a broad group of stakeholders, and also to the skill with conducting those discussions and probes that incorporated politics, but in an apolitical manner. Anyway, I just wanted to comment on the skill that I observed with that. But so as Val said, when you see the number of inquests that are waiting, it's daunting and discouraging. I don't know if you go to work every day and think that is daunting and discouraging. And so part of the question is like resource planning to address those. But the other maybe more specific question is, can you give me or us an example of what would be a recommendation that would come from an inquest as opposed or as maybe more strong, a stronger recommendation than say what we saw in a review? Can you give me an example of an inquest outcome versus a review outcome?
So first, one, thanks for the comments and certainly all the previous learning and involvement and all the rest of it, because as I say, that output of that report was a result of many people and everybody that was fully engaged and interested in wanting to do all of these things. And so thank you for that. In terms of an inquest versus this report, it's a very good question. It's hard to say what would be a very big difference, but what I find, and I'm also an inquest coroner, so certainly have done a few inquests. The process of an inquest that I find profound and unique is, one, you have the parties withstanding. So the people, we communicated with all the levels of government, so they would obviously have standing, and standing just means they have essentially a connection to something that will likely be discussed at the inquest or may be impacted by the inquest. Obviously, the family inherently has standing, but all the agencies, the expert working group, the union, several of the health units, the ministries and the federal government and their departments of relevance, all of them would be potentially granted standing. Obviously, they would have to apply, but essentially, you have all of these people discussing the processes and the events that contributed to the death. And then you have a jury that represents the sort of public peers. And it is they who are charged with the responsibility of, coming up with recommendations based on what they hear at the inquest. So one of the differences between the report and the inquest is an inquest can only come up with recommendations based on the information heard at the inquest. They can't presuppose a different condition and apply a rule to a condition that wasn't discussed or wasn't raised. Whereas with this report, we had that leeway and utilize the expertise of all of the participants to engage in other things and come up with some sort of broader recommendations. However, the impact of the story of seeing the life of the individual very explicitly discussed and openly pursued to the realm of, one, informing the public, but also with the strong goal of setting up systems and preventative abilities. I think the recommendations may very well have been quite similar, because what happens at an inquest is the different parties propose what they see as recommendations to the jury to consider. And sometimes those groups unify to send in a combined list of recommendations, as well as develop their own individual ones that there may not be as much consensus around. So certainly you generally have more people that are engaged for a longer period of time, because it's day to day to day until the inquest is finished. And then you have the involvement and the potential feedback that generates from that public discussion. And sometimes that public discussion of the events generates a area to pursue that wouldn't necessarily have been pursued when you don't go into the in-depth details of the case. So hopefully that answers your question, but I can't give you specifics, because ultimately in reviewing 3 people's deaths, the specifics were not so specifically addressed, because there was a limitation around some of that, whereas we talked about the sort of broader concept stuff. But I think sometimes when you go into the specifics, even of an individual person's death, are quite profound and important to know.
Yeah, thank you for that. It does help clarify some things, but raises more questions. So for the next time.